So now let's get to our Maui Grown Manaʻo program. If you don't know him, you're in for a treat. You'll be surprised at how much you will learn in just 20 minutes. And welcome back to Maui Grown Manaʻo. This presentation will provide you with information about using cannabis as part of an integrative health program. Now it's my pleasure to introduce Michael Bacchus.
Hi, Anela. Thanks for having me. Hi, everyone. Aloha. I'm very happy to be here today. We're going to talk about insomnia today, how cannabis might be used to reduce some of the symptoms associated with insomnia. So there are a couple different kinds of insomnia that we're going to focus on. Classic chronic insomnia, which means basically just difficulty, going to sleep or staying asleep. Normally it's chronic if it takes, at least 3 nights a week, you're having problems sleeping, and that persists for 3 months or more. And, at some point you might want to talk to your doctor about it if it's ongoing like that. There's also what's called comorbid insomnia, and that's insomnia that's related to other symptoms or a medical condition. That could be pain, that could be anxiety, muscle spasms, etc. Today, we're going to look at 2 common manifestations of insomnia, and those are called onset insomnia, which is just difficulty falling asleep, and maintenance insomnia, which is the inability to just stay asleep. What's great is cannabis can be used to address both of these. And cannabis can also be used with some consultation with your doctor to get off prescription sleep medication. A lot of people who have been taking prescription sleep medication for years are dependent on it. And working with your doctor, you can use medical cannabis to potentially get off prescription sleep meds completely. But let's talk about what's in cannabis that can address insomnia and the inability to fall asleep. So THC is not actually particularly sedative, but what it is it's relaxing. And that ability to get you to relax, and it's a mild hypnotic to some degree, can actually help sleep onset. So the way I like to look at THC is you want to use it for specifically the kind of insomnia that you're dealing with. If it's onset insomnia, it's difficulty falling asleep, then what you want to do is you want to back off a period of time, up to 2 hours before bedtime. Dose THC. You can take it orally, which takes longer to take effect because it has to be processed through the liver, or you can inhale it closer to bedtime, but you still want to back off a bit. Typically, I recommend for most people that they use it about an hour before bedtime if they're inhaling it, and 2 hours before bedtime if they're taking it orally, let's say in a tincture. Now, what happens is that gives it some time for it to build up, the THC to build up your blood plasma, and you'll start to unwind. Now, what's great is THC is not the only ingredient available in cannabis, and so there are a lot of different things we can bring to the table here depending on what we're dealing with. For example, the most common symptom that people report for using medical cannabis is trying to address pain. Pain can interfere with sleep, and it's very, very common that people will come in and they'll have pain and sleep as their 2 major issues. So what you can do is you can use THC's pain relief ability, but you can also use CBD, another cannabis constituent's ability to help some aspects of what keep you from falling asleep. You can use CBG, which you may or may not be familiar with, but CBG is another cannabinoid. It's what the plant uses to make THC and CBD. But by itself, CBG, which is found in a few kinds of cannabis and cannabis products, is not sedative, but it's analgesic. So if pain is your major issue, a combination of THC and CBG may be helpful in distracting you from the pain and relaxing you enough to help you go to sleep. The last cannabinoid I'll talk about is CBN. CBN is not produced by the plant. CBN is produced when THC oxidizes over time. If you just leave THC out in a room for months and months and months, even years, it'll start to build up CBN. And CBN by itself is mildly sedative, but it's even more effective when you combine it with THC. So the point here is you want to build a combination of things to increase your likelihood of getting the outcome you want, which is going to sleep and staying asleep. So my favorite combination is THC, CBG, and a little CBN. You can use any combination of those that's available to you. They'll almost always, if you're getting CBG and CBN, typically you'll have some THC along for the ride. Now, you may have noticed that I left out CBD. CBD is really helpful because it can reduce anxiety. However, the drawback to CBD is if you're really sleep deprived and you take CBD, it'll have a tendency to put you to sleep. But at low doses, the kind of doses we normally take of CBD, it'll promote wakefulness over time. So what I find is if you're sleep deprived and you take CBD, it'll make you sleepy, you'll sleep. But once you start to catch up on your sleep, it can keep you up if you take it at night. So what I recommend is if anxiety is keeping you up, take your CBD early in the day. Take it at, with breakfast, take it again after lunch, but don't take it after about 5 in the afternoon. What I've noticed with anxiety patients who are having sleep issues is that if they take their CBD earlier in the day, it has a tendency to kind of interfere with the anxiety cascade. So they get less anxious in the evening because they've maintained a lower level of anxiety throughout the day. So typically I don't use or recommend CBD for sleep. For some people it does work, but the clinical evidence shows that it's really effective at doses far in excess of what most people take. CBD typically takes as much as 150 milligrams to really be considered sedative. And for most people, that's just not practical and a little too expensive. So let's just review this really quick. THC is fantastic for sleep, but take it 2 hours to an hour before bedtime and kind of tune it for how it works for you. In a minute, we'll talk about the dosing and how you get the dosing for that. Take your CBD if anxiety is part of the cluster of symptoms that's help keeping you up. Take it earlier in the day. And it may be that it's not anxiety that's your issue. It could be neuropathic pain. Same thing. You want to take the CBD earlier in the day. CBG, well, it usually comes along for the ride with certain cannabis strains or cultivars. And if you get a cultivar that's 20% THC and 2% CBG, that may help you by having increased analgesia, less pain, and that'll help you relax and go to sleep. And then CBN can actually be made just by oxidizing THC, and it can be available in combinations with THC and capsules and things. And it's mildly sedative and can really be helpful. So to review, my favorite entourages, cannabinoid entourages for insomnia are THC, CBG, and CBN together, and THC and CBG together. Those really work for people. And a lot of the stuff's covered in the notes that you were given today. And if you didn't get the notes, you can get them on the website. Let's talk about terpenes and sleep. Cannabis produces essential oils called terpenes. These terpenes interact with the cannabinoids like THC, CBD, CBG, and CBN. And these terpenes actually have sedative effects on their own or effects that help support restful sleep. The best one is linalool. Linalool is found in Kula lavender. It's responsible for the smell of lavender and some cannabis varieties. And it's an excellent entourage addition. So if you're looking at a vape card or a cannabis flower to use, and this is principally for inhalation, you can ask for something that's got linalool in it. And I find personally that the most effective sleep preparation that's cannabis-based for me is THC and linalool together. Now, what's interesting is you don't have to get your linalool from cannabis. You can get it from lavender oil. And so you could take a bath with lavender oil an hour before bedtime, and then take some THC right before you get in the bath. Don't fall asleep in the bath. And you'll find that it's synergistic with the THC. The linalool is really quite potent. In fact, in mice studies, when they have mice inhale linalool, it drops their blood pressure dramatically in about 5 seconds. It's really, really potent. Now, it's more potent in mice than it is in people, but it's still potent. Another terpene, another essential oil that's really interesting is linalool. Linalool, is myrcene. Myrcene is the most common terpene found in cannabis. And myrcene was thought for many years to be responsible for any sedative effect in cannabis beyond that of THC. We've learned recently that that's not completely true, but it does increase the impact of THC. And it's really helpful for relaxing. So what happens is it's quick acting. It doesn't last very long, but it does increase the effectiveness of THC. So you can get a high myrcene variety of cannabis that's high in THC, and you'll find typically that it'll have a more relaxing effect, which can lead to sedation. Last one that I really like is limonene. Limonene is the kind of, it's found in orange peel. It's responsible for the citrus aroma in a lot of cannabis. And what's great about it is it lifts mood and it reduces rumination. So, obsessive thoughts can make it really hard to go to sleep and just put you in a better mood. And at low doses, it can be really effective. So you get a lot of choices here. You have choices of 4 different cannabinoids. These 3 terpenes. There's a 4th terpene called beta-caryophyllene that's really common in cannabis, which should be really tricky with it in sleep because it's a little edgy in its effect, and it actually can contribute to making you a little activated before bedtime, which is obviously not what we're looking for. So let's talk about dose and administration, okay? There are 2 ways to approach this. One is you could just go with an oral strategy or an inhaled strategy, or my favorite, which is a combination. For oral THC, 2.5 to 10 milligrams of oral THC 1 or 2 hours before bedtime is an effective dose for most people. Now, you gotta be careful if you don't use a lot of cannabis, because doses over 5 milligrams can cause dry mouth. 10 milligrams can make some people euphoric enough that they actually wake up. So you gotta just be really careful. You have to know your own tolerance to cannabis and adjust your dose accordingly. But for most people, 5 milligrams is a good oral dose. High doses are usually required when you have some dependence on prescription sleep medication. I find that people who take a lot of Ambien, it usually requires a higher dose of THC to start to offset the effects of reducing your Ambien dose. Again, but if you're going to reduce your Ambien dose, you've got to talk to your doctor. There are some issues with coming off Ambien that your doctor can help you with, and that's not for us to discuss today. Inhaled THC. Inhaled THC can be taken anytime between 5 minutes, 60 minutes before bedtime, it actually reaches a peak plasma concentration very, very quickly. So it's really convenient. And here's a trick, which is using the combination of oral THC and inhaled THC. When you use oral THC and inhaled THC together, what you get is you're getting two different metabolic pathways within the body, which means that you inhale the THC, it goes through your lung tissue, into your blood plasma, and you feel it very quickly. When you swallow it, it has to go through first pass metabolism, which means it goes in your stomach and into your small intestine, into your liver, and your liver transforms it into a different drug. That takes a while, all right? But if your problem is waking up in the middle of the night, you want to use oral THC because it takes a while to take effect, and you can use that in your favor by simply taking your dose right before you go to bed. And what happens is you'll have peak plasma concentrations of these cannabinoids in the middle of the night where most people normally wake up, which is after the second sleep cycle. So they go to bed at 11 o'clock and pop awake at 3 in the morning. I found with a lot of people who have this issue, including myself, THC orally right before bedtime works spectacularly well. And then CBD, as we discussed, if you're dealing with anxiety, and that's one of your issues that clusters around your insomnia, morning and afternoon doses, let's say 8 a.m. and 1 p.m., 10 milligrams of CBD can be really effective orally. And I know a lot of people who've used it. However, let's talk about one thing in dosing all of this stuff. I like this idea. A lot of people get very, very dependent on sleep medication, whether it's cannabis or prescription or whatever. And I really like this idea of 4 days on, 1 day off. I like to mix it up. I don't want to make anything too habitual because the clinical research shows that it tends to work less effectively if you use it every single day. So, well, what do you do on the days where you're not doing this? Well, one of the things about using cannabis is I think it's best as part of kind of a lifestyle approach. And there are a lot of different strategies that have been shown to be effective for sleep that are not cannabis related and not pharmaceutical related. One is getting out in the sun, getting exercise, practicing what they call sleep hygiene, which is simply going to bed at the same time every night, using the same pillow, making sure you're cool enough and not too hot. All of these things, and it's really easy to research this online. And then there's also a mixed herbal approach where you're not just using cannabis as an herbal medicine to address your sleep issues, but you're using things that have been shown clinically to work, like valerian root, for example. Some people like chamomile tea. I've already spoken about lavender oil, which I think is phenomenally effective. And there are lots of different approaches here. There are traditional Chinese medicines as well that can be used. And what I like to do is I like to mix it up. So I'll use maybe cannabis for 4 days, and then I'll switch to lavender oil and valerian for a couple of days, then back to cannabis, then valerian for 4 days, and then 2 days cannabis, and really mix it up. And kind of keeping your body, not knowing what's coming next to some degree actually can help in cases like this, because the habitual use of any substance can reduce its effectiveness over time, and we want to avoid that in this particular case. So, and the last thing, cannabis hangovers. The only cannabis hangovers I've really noticed related to insomnia, in other words, you wake up in the morning and you're groggy and you don't feel sharp, are from people who basically take oral cannabis preparations to excess, or take oral cannabis preparations that have been made with high amounts of myrcene. Myrcene can make you really groggy in the morning. Now, these oral preparations with myrcene. Myrcene's really hard to keep around, so it's really hard to stabilize in a tincture. So that may not be an issue for you. But if you are using a high terpene tincture, that can potentially be an issue. You can be a little groggy in the morning. Caffeine and exercise can clear that up very quickly. So I'm going to swing into questions. There were a few questions and a few rather complex questions that came my way before this. So I'm gonna bop out a little bit early and turn it over to my friend Anela to help me manage Q&A.
Great information, Michael. We have a ton of questions coming in for you. First one is, do certain cannabis varieties have high amounts of CBG and CBN? Yeah,
well, basically only old cannabis has CBN. So the way I used to say it is, if it's got CBN, it's been mistreated, or it's been intentionally, cured to produce CBN, which happens. CBG, yeah, it's the skunk varieties. So the old school skunk varieties from back in the day, skunk number 1 was bred by a guy named David Watson. And it's one of the few varieties that consistently produces around between 2 and 4% CBG, typically closer to 2. But yeah, and it works great. And so they're around. The famous variety Green Crack, that's also called Green Queen or Dream Crack or whatever. Those are part of the what they call the sweet skunk varieties, and they're almost always high in CBG relatively.
Very good. Here's another good one pertaining to CBG, CBD, and THC. My 19-year-old son suffers from insomnia. Is THC or a combination of THC, CBG, and CBD safe for his growing brain?
Wow. Well, the evidence is a little bit out on that. There's no question that the body's endocannabinoid system is responsible for neurodevelopment, brain development. And so there's some question about the potential impacts of taking THC when you're under 25, which is surprising to most people, because a lot of people who've used THC started using it much younger than age 25. Now, there is some evidence coming out of Australia and England that CBD can protect the brain from these detrimental neurodevelopmental effects. And I think the evidence is good. I mean, it's early, but it's good. And so my recommendation is if your son's physician recommends medical cannabis, and I would just make CBD part of the entourage that they take, just for its potential neuroprotective abilities.
Okay, great. Next question for you, Michael. I can't sleep because of racing thoughts. Can cannabis help quiet my mind?
Yeah. So what you're looking for is what they call a hypnotic effect. Okay, that kind of gets you off it. And my favorite for that would be THC, linalool, myrcene, and then CBD during the day. I find that a lot of people who have even mild OCD and have a tendency to ruminate and obsess can really be helped by the calming effect of CBD. And what's interesting is, because CBD really isn't particularly sedative, is interesting is it's wake promoting, but it doesn't make you speedy and kind of filled with anxious thoughts like caffeine can provide. So
good. Here's a cannabis flower question. Can I age my own flower to increase CBG content?
No. So the CBG content is basically what's left over. So here's how this works. The plant produces CBG. Then one of 2 enzymes goes to work on that CBG and converts it to either THC or CBD from the original CBG. The CBG is just there, or it's not. Now, if you want to age cannabis to increase something, you can age it to increase its CBN. So just abuse it. Leave it out, throw it outside on the porch. Come back and get it a month later. Don't talk to it. So you actually can increase CBN over time.
CBN, not CB.
But it'll be at the price of your terpenes. So if you're liking your terpenes, you're liking your linalool, and you're liking your myrcene, forget about it. If you're going to try to abuse your cannabis to produce CBN, because you're going to get CBN, but you're going to lose those terps.
Got it. Where can we get these mixes of THC, CBG formulated for my specific needs?
Well, just get into a little cannabis chemistry. I mean, I think the biggest thing to do is to just ask at your dispensary, find out what's in your cannabis. All the stuff is tested, so it's really easy to get these results. And then just put together the salad, as I call these mixtures, these blends of cannabis flower to get the effect you want. My favorite thing to do actually is take a few different kinds of cannabis, blend them together, and then put them in my trusty Mighty vaporizer, and it works great. But you have to remember, when you vaporize cannabis for terpenes and cannabinoids, they're going to come off the vaporizer at different times. The terpenes will come off first, then the cannabinoids. So you have to be patient. As I've said many times, vaporizing cannabis flowers is like smoking in extreme slow motion. You're going to get different things at different times, and you have to understand that. So you don't leave a bunch of cannabinoids and think you're done. Okay, which a lot of people do.
Very good. Here's a common question we often get in the dispensary. I wake up every morning at around 3 a.m. What's the best way to use cannabis to get back to sleep quickly?
To not wake up in the first place is the best, which means, as I said, take a tincture right before you go to sleep so that it's still working when you normally would be waking up in the middle of the night. And honestly, for a lot of people, just that tip alone will help them sleep through the night. Now, let's say that doesn't work and you do wake up in the middle of the night. I recommend a very small dose of THC inhaled, preferably the vaporizer, and that'll usually work. But don't overdo it, because you can get too high and not go back to sleep and end up surfing the internet. And the next thing you know, you've read the Wall Street Journal 3 times before 6 a.m. Of course, actually, for me, reading the Wall Street Journal 3 times before 6 a.m. would be absolutely guaranteed to put me to sleep. So.
Okay, you talked about valerian earlier. What is it and where can I buy this?
You can buy it at one of Maui's wonderful health food stores, of which there are several. And so Down to Earth has it. Yeah, it's really easy to find. It's just go into Down to Earth. They'll be thrilled you're asking.
Okay, THC and CBD capsules in the past I've noticed that I often wake up when using this. Should I try pure THC instead? What about any other capsules you would recommend for sleep?
So is that question related to THC and CBD combo capsules? I mean,
combo capsules. Yes.
Yeah, no, I'd separate them. What I do is I take your THC. The best way to do this is take your THC in capsule form, get the dose that works for you. Take your THC and CBD in tincture form. So take like a Kula Cherries tincture, and I separate the two, because then I can adjust the dose. Because typically what I'm going to do is I'm going to take that Kula Cherries tincture in the morning, and I'll take the THC capsule at night. And because I'm concerned about CBD promoting what they call wakefulness in people who are trying to go to sleep.
Perfect. Okay, here's your last question, Michael. In the dispensary, we offer a cultivar called GG number 4. For this particular person, it intensified and provided small discomforts, and I could not sleep. What specific recommendation can you make besides Ambien that I've taken for years?
Well, okay. Here's the issue with GG4. GG4 is a real high THC strain of cannabis cultivar, and so it might be kind of overkill for some people. So you can do two things. One is you can drastically reduce your dose of GG4. If you're trying to replace your prescription Ambien with cannabis for sleep, first, as I said, you should definitely talk to your doctor about it. And you're going to have to realize that it's going to take about a month for most people to make a transition off prescription sleep medication to cannabis. And so what it is over time is you slowly, with your help of your doctor, taper off your dose of Ambien and slowly increase your THC dose. But you may actually start at a higher THC dose than I'd recommend for an average person. You may start with a dose as high as 10 milligrams right at the beginning. It really depends on how long you've been on Ambien, how hooked you are on it, how dependent you are on it. And so it's a slow transition process regardless.
Our new live event series delivers free bite-sized information that you can use right now.
There's an enormous amount of misinformation out there. You can build entourages for sleep, for pain, for appetite, anxiety.
Thank you all for attending.
Thank you. See ya. Bye-bye.